Hello, everyone. My name is Favor Etsumune. Today, I'll be discussing my future plan as a prospective nurse practitioner psych. Please allow me to share my slides for a better understanding. Throughout this course of learning, I have gained deeper understanding on the role of advanced nurse practitioners. And I've learned a lot of factors that might impact on their practice. As a prospective psychiatric and mental health nurse practitioner, I recognize that these roles extend beyond providing clinical services to promoting holistic healing, advocacy, and compassionate service. In this presentation, I will be reflecting on my future plan as a psychiatric and mental health nurse practitioner. I will be discussing on some of the needed training to be a better nurse practitioner psych. I will discuss how social, legal, economic, and global factors might impact on this plan. I will also discuss on how my role model, who is Hildegard Pepler, will influence me in my being an effective evidence-based nurse practitioner psych. And finally, I'll be discussing how Christian worldview will shape my practice as a prospective psychiatric and mental health. And I'll be utilizing one of the Beatitudes, which is, "Blessed are the merciful, for they shall obtain mercy." My future plan, my goal as a prospective nurse practitioner psych includes providing a comprehensive mental health assessment and diagnosis. I plan to deliver evidence-based treatments, including medication management and psychotherapy. I plan to provide a holistic patient-centered care by addressing patients' emotional, mental, and spiritual needs with compassion and respect. One of my plans is to advocate for policies that improve access to quality mental health care. I also plan to advocate for reduction of stigma associated with mental illness through education and advocacy. Yet another plan is to promote mental well-being, prevention, and early intervention strategies. I plan to serve as a leader in advancing mental health awareness and improving patient outcomes. There's always room for learning, more education to be a better nurse practitioner. The trainings I plan to engage in includes pursuing a continuing education in psychopharmacology and emerging psychiatric treatments. Yet another training I might need will include obtaining certificates in mental health counseling and behavioral therapy. I will plan to obtain specialized training in psychotherapy modalities such as cognitive behavioral therapy, CBT, dialectical behavioral therapy, DPT, and trauma-informed care. I also plan to continue education in telepsychiatry and digital mental health technologies. I plan to develop leadership and healthcare policy advocacy skills. With all this, my plan, there are a lot of factors that might affect them. There are a lot of factors that might affect the success of this, my plan. One of them is the social factor, which include health literacy. A lot of illiterate people may not understand the importance of mental health illness. Another one, the mental health stigma, which includes cultural beliefs and attitudes, family and social support systems, social determinants of health, and substance use. We all know that social factors do have a significant impact on individuals' mental health and ability to access care. As a future psychiatric and mental health nurse, I will strive to understand each patient's unique circumstances and provide a compassionate, holistic care that supports my patient's emotional, psychological, and spiritual well-being. Legal factors are yet another things that might affect my plan, such as the scope of practice, the prescriptive authority regulations, licensure and certification requirements, reimbursement and insurance policies, telehealth regulations, and then mental health and involuntary treatment laws. Legal factors shape every aspect of psychiatric and mental health practice, from prescribing medication to documenting care and providing telehealth services. Understanding the scope of practice law, patients' rights, privacy regulation, and liability issue is essential for a safe, ethical, and effective psychiatric care. Yet there is economic factor that might affect my plan, such as mental health workforce shortage, healthcare reimbursement policies, telehealth economics, socio-economic determinants of mental health, cost of mental health services, insurance coverage limitation, and the rising healthcare costs. By understanding these healthcare costs, all these factors, I will be better prepared to deliver efficient, high-quality mental health services while advocating for a greater access and affordability for my patients. Global factors that might affect me includes the global mental health burden, the shortage of mental health care providers, the global stigma surrounding mental health illness, the emerging global crisis, expansion of telehealth and digital psychiatry, and the cultural differences in mental health perception. As a prospective nurse practitioner, awareness of these global factors will aid me providing a culturally sensitive, evidence-based, and compassionate care while contributing to improving global mental health outcomes. I'll be discussing my pioneer model, who is Hildegard Pepler. She is the mother of psychiatric nursing. She developed interpersonal relationship theory. She influenced modern psychiatric roles in therapy, communication, and mental health assessment. She emphasized the importance of the nurse-patient therapeutic relationship, and she promoted the idea that nursing is a healing and interpersonal process. Her contribution will continue to shape my practice by reinforcing the importance of patient-centered and compassionate care. From the Christian worldview and the Beatitude, I chose "Blessed are the merciful, for they will be shown mercy." The application of this Beatitude is that it will enable me integrate faith-informed values such as kindness, patience, and humility into clinical practice. Show mercy and empathy toward individuals with mental health illness, and provide holistic care that supports emotional, psychological, and spiritual healing. It will enable me advocate better for the vulnerable and underserved population with fairness and compassion. And it will enable me advocate for a reduction of stigma by promoting understanding and grace in mental health treatment. Mercy, we all know, is compassion put in action. When people are struggling with depression, anxiety, and other mental health illness, mercy does not demand that they simply overcome their feeling. Mercy does not accuse them of lacking faith. Instead, mercy responds with empathy, offering a listening ear, support, encouragement, and remains ever present. In conclusion, my goal as a prospective nurse practitioner psych is to be guided by Christian worldview, grounded in mercy, compassion, and respect for human dignity. I will be guided by Pepler's therapeutic relationship model. I am committed to becoming a compassionate and competent psychiatric mental health nurse practitioner. I will continue to grow through advanced training, lifelong learning, and professional development. Thank you for taking out your time to listen. The next of the slide is on the references. Do have a great day. Thank you.